Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, July 12th, 2020, COVID update. So the bigger news today is, once again, we were over 60,000 cases. I think we've been over 60,000 cases in the country for the last 5 days. 15,000 new cases in Florida, about 650 to 60 in Oklahoma. We're at 499 patients in the hospital, 422 deaths. So we've had a little increase in the number of people who've died from COVID. The hospitals now definitely have the most they've ever had. They are completely saturated. So one of the things people don't understand is the governor last week said, oh, there's 5,000 beds and there's plenty of room at the inn. That made sense in March when we stopped all surgeries that were not urgent. I hate using the word elective because that gives an impression that some of these surgeries aren't needed. An elective surgery would be, let's say, commonly a rhinoplasty or a nose job, a breast augmentation, things like that. Those are just completely somewhat optional surgeries, and I'm sure someone out there has had a rhinoplasty for an urgent reason, but for the most part, those are not anything but electives. But things like bleeding, if you're a woman, terrible pain, cancer, all of that stuff was stopped in March and April. So that emptied out the hospitals and they really limited admissions. So there was about 4,200 beds available on any given day, plus, or a little bit over that, on any given day in the state of Oklahoma. Well, now hospitals are having to be busy. And so they have to make up. There's a huge number of things being done that are still being made up for the prior 3 months, plus the normal wear and tear on the human body and illness. So the hospitals are running normally where they do, which is about a 90-95% capacity all the time. So having 500 more beds for COVID patients isn't easily accomplished. So when the governor said, yes, there's this many beds and this much capacity, that's if the whole system is shut down. And when the system isn't shut down, and it's not going to be shut down again, I don't anticipate, people have to get their care. The estimate at the end of May was more than 300,000 undiagnosed cancers in the United States from delays in diagnostic testing. Several 100,000 cancer patients hadn't been treated, plus all the other things from heart catheterizations to pelvic pain. I'm a gynecologist, pelvic masses, incontinence, general surgery cases, ENT cases, all this stuff. So people are having to get their things done now. And so it's really hard to go back on that. Plus, the reality is the hospitals are all going under. Once again, people have thought, oh, the hospitals make all this money. The hospital systems are at bankruptcy. They're all at bankruptcy. So they need to do cases and admit people with routine things in order to stay open and keep their staff employed. So it's a real problem in Oklahoma and everywhere now because we kind of used up our dry powder in April and March, and then now that things are really heating up, it's hard to have the capacity. So that's what's going on. So right now, with 500 patients in the hospital in Oklahoma with COVID, that completely saturates the system. People have to stay in the ER for a day or two before they get to a hospital bed, depending on what the situation is, all throughout the state. So it's a problem. So let's move on from there to just nationally. Obviously, Texas and Houston is just a disaster. Florida's turning into a disaster. Maricopa County and Phoenix area is very difficult. And then there's multiple areas in California which are starting to pick up. So we'll just have to see what happens with that. We just have to hope that we don't get a bigger pop in the northern parts of the country. There's a lot of different theories why the southern part versus the northern part. Some may have to do with the restrictions being relaxed on socializing. Some may be there's a lot more inside time in the southern states because it's hot and there isn't great ventilation in buildings, and so it's easier for it to spread. Once again, getting to the concept of wearing a mask. And so that's our central theme again. For going back to school, it's wearing a mask. Going to work, it's wearing a mask. Going to Home Depot, it's wearing a mask. Going to your doctor's office, wear a mask. Don't get mad if people ask you to wear a mask. Why would you get mad? You should be part of the solution, not part of the problem. But if you do have frustrations with that, stay home. Don't go places where people are going to want you to wear a mask, to be considerate. But the last thing on earth you should do if someone asks you to wear a mask or they want to take your temperature before letting you in to a building is get in a fight, scream at them, yell at them, abuse them. Let's keep our kindness going through these situations. So that's a real problem, is people getting so mad. So just how it is. So going to college. So we have a kid going to college. So that's going to be a challenge in the next month, for perhaps less, for kids going to school, moving into dorms, getting set up. I mean, how are they going to do that? Well, each school is going to have its own methodology, but most of them are going to have some combination of smaller dorm, or either single dorm rooms or double dorm rooms per usual, but then there'll be much more limited classes. In terms of going to class, there'll be a lot of online classes. That's just for safety. Again, I don't think there's a huge issue with kids going to class at all, as long as they're a little bit spread out and they have masks on. I think the big issue is for the teachers to be protected, and again, they need to be wearing masks also. But I think the big thing is the students may get sick a little, but the teachers can get really sick, like I talked about. So for going to college, what I would always want everyone to do is have your kid on, I mean, let's keep it easy for someone who's 18 to 23, a multivitamin that has zinc in it. I mean, if you can just get them to do that, it would be wonderful. And give them Flintstones. I mean, that isn't optimal, but it's still pretty good. So you want them on a multivitamin. If you can keep them on a multivitamin, they're going to have a little more resistance to everything. The second thing, a little zinc, 15 milligrams would be wonderful. Again, we don't want their stomachs to get that upset, so if we keep them at a little lower dose, that's going to be super helpful too. Third, we could keep them on some vitamin D or elderberry. But again, these are college kids, so let's keep it easy on them. Next, give them a bunch of masks to bring and encourage them to wear them and go through it with them. That it's not just for themselves, which is a smaller point, it's for their teachers and any older people or any students who may have health problems who really would suffer if they got COVID. And then finally, some hand sanitizer and lots of Lysol wipes. But part of the problem with this group is getting them to do anything. So that's just going to be the issue. But I don't want people to worry so much about the college kids or the high school kids or the elementary school kids getting sick. It's that they could give it to someone that we really need to focus on, which is why schools need to mandate masks. And you have to accept that. And if you don't want your child to wear a mask and the school has mandated that, my suggestion would be to homeschool, because then you can do it the way you want to do it, and then there's no conflict with people who make recommendations for this and are trying to manage large groups of people. So that's the take-home message tonight. In terms of the future, I think we're going to see more and more cases. I don't think that's going to change. Thankfully, the average age is about 15 years younger, so the death rate or case fatality rate should be much lower. I'm hoping it will go to 1 to 2% overall from our kind of baseline 4.5 to 5%. Because again, the younger people who make up the predominant portion of this flare are not going to get as sick and are usually not going to die. But again, as we see in the news, there are plenty of people who do get COVID and do actually die from COVID. There are, of course, a mix of people who have a COVID diagnosis and something else, and that always causes confusion and filters into the conspiracy theories about COVID. But there are plenty of people who just die of COVID without any collateral illnesses at the same time, or a secondary infection to COVID, when in reality COVID may be the secondary infection and the primary infection is what can cause someone to get really sick. So that gets very confusing. So that's my summary tonight. Tomorrow night at 7:30 we're going to do live questions on Facebook, correct? So if you have questions, you can type them in and Kim will be doing that. Were there any questions? There were a few questions tonight she wanted me to answer. Go ahead.
easier to go ahead and do some now. Can you talk about THC and or CBD in the immune system?
So THC and CBD are normalization agents in the immune system. So if you're using a THC or CBD product, as long as you're not smoking it, you're probably keeping your immune system balanced. I would not use CBD or THC as first-line therapy for COVID. There's no data to support that. But CBD and THC in a non-smokable form or a vapor form would definitely, and it's not that the other two wouldn't help your immune system, it's just that you're going to hurt your lungs, and if you get COVID, that's kind of defeating. So, but THC and CBD definitely can augment or stabilize your immune system.
And then the nebulizer, the budesonide, however you say that.
Mm-hmm. So what the Texas doctor was talking about, it's Budesonide. I've said it a million times, and now, of course, I can't. So that's just an mild inhaled steroid. So the question is, do mild inhaled steroids matter in the early course of treatment? So I put that paper on the 7 things that you could do early if you're a physician, or potentially some of the things you can do as a patient, and you get COVID. And so there is a role potentially for early use of a corticosteroid, either inhaled or orally, to help decrease inflammation in the lungs. The data on that is evolving, and that's very, very good data to be watching. And I think it would, if someone is having pulmonary symptoms and they're not getting better, they're on their Plaquenil and they've done an antibiotic, it would be very reasonable to put them on a low dose of a steroid, whether inhaled or oral. But again, that'll be something you'll need to talk to your physician about in order to do that. But what the gentleman in Texas has talked about, there's no papers on that published in any kind of systemic review. Now, I do think it probably works, but again, thinking it probably works is different than having proof it probably works. But again, if you go to the paper I've put on multiple times, they suggest some type of steroid intervention that's mild, because it's going to probably help, and it's pretty darn harmless. It shouldn't make anything worse.
You had a couple of questions about elderberry. Is it okay to do it in gummy form?
Sure, elderberry's fine in any form, whether it's a syrup, a gummy, a lozenge, it's totally fine.
And then a couple of people wrote in saying they've heard that elderberry can cause inflammation, especially if you have autoimmune.
No, elderberry is just not that way. That's a worry people have with zinc. Natural things like elderberry and zinc, vitamin D, omega-3, they're stabilization, normalization agents. They don't augment that. I mean, that's a common misperception people with autoimmune disease have, that these very basic macronutrients and mild interventions are going to make things worse. They're not.
Okay, we'll just stay on the supplements. NAC.
Nicotinamide acid. Again, that's a macro. Oh no, NAC is N-acetylcysteine. Sorry, N-acetylcysteine is a supplement that is anti-inflammatory, but it's classically anti-inflammatory in the brain, and it's anti-inflammatory in the liver. So we use it for mood disorder and to help improve mood, clarity of thought, complex thinking, because it decreases brain inflammation. It is used for TBI, traumatic brain injury, any kind of inflammation in the brain. It's a totally safe substance. My favorite comment in a paper by PhD is there's never been a more benign substance with more clinical utility. So, I mean, meaning it's very, very helpful for a lot of things. Again, totally fine to use. No data for COVID, but totally fine to use.
You want one more?
Uh-huh.
Have you heard about it being transmitted by mosquitoes or flies?
I have not heard of it being transmitted by mosquitoes or flies. It definitely can be, even though the World Health Organization and Dr. Fauci seem to begrudgingly admit that it's transmitted somewhat human to human and by just breathing, that is there because we know it aerosolizes and it stays in the air for long periods of time. Number two, it's on surfaces. So surfaces and air, and then direct contact. If your significant other has it, you kiss that person, you're going to probably get it. Just likewise, why we don't shake hands anymore. If that person coughed in their hands and touched their face or something and they have COVID on it, and then you do it, gets on your hands and you go like this, it can get in your eye or mouth, boom, you get it. So there's direct contact, aerosolized, and surface.
That kind of goes along with one more. And I know you've talked about this in the past, but if you test positive, what would be your advice on quarantining in the same house with your family?
That is an excellent question. In a perfect world, you would quarantine away from your family as much as possible, especially the first 10 days, because most of the virus, from the first day of symptoms, when you look at the CDC guidelines, at 10 days, the vast majority of people are not infectious anymore. If you go to 12 days, you're really getting probably to about 98, 99%. But if you can quarantine away, that's much better. You don't want to have someone with COVID as much as possible around the entire family, that they'll spread it to the whole family, which was what happened in China and has happened in New York and happened in Italy. That's why there's case clusters when you look at meatpacking plants and bars and places and prisons, because people are close together. One person gets it. That's the greatest example of quarantine. You're in jail and one person gets it in the jail cell, and voila, all of a sudden the whole inmate population has it. I don't know if the solution is letting everyone out of jail, because that may not go so well, like it's happening in New York with the Rikers Island release of all those inmates. I'm not being political, just observational. But that was a health benefit for them, but maybe not a health benefit for the city with the increase in violence. But who knows? I mean, who knows? So that's why you don't want to quarantine with someone if possible with COVID.
That's good.
Okay, thank you. I know that last answer probably wasn't perfect, but that's reality. Being locked in a room or a small apartment with someone with COVID for a week is probably going to get you infected. So that's what you want to avoid. So that's it. Good night.